Welcome to the next episode of Health Basket. Yes, simple mantra to be remembered in diabetes is high sugars actually do not give symptoms. That is why diabetes is called a silent disease. So, unless the sugars go very high, when I say very high, above 350, 400, and that too for a prolonged period of time, most of our patients do not have any symptom. Once the sugars are persistently above 300, 400, many times you would see patients losing weight, they will have lot of thirst, drink lot of water, go to the loo very frequently. These are all symptoms which will happen. It's very commonly known to people. If you want to diagnose diabetes correctly, don't wait for symptom. Check it every year, especially if you have a family history of diabetes or ladies who have had a history of diabetes in pregnancy, please check it. Don't wait for sugars to give you symptoms. Symptoms, as I said, will happen only when in high sugars. In contrast, low sugar is pretty serious. There are hormones secreted by important glands in the body called the adrenal gland, which secretes cortisol, epinephrine. There is one more hormone from the pancreas called glucagon. They all try to elevate, keep your sugars always above 60 and 70, and it will break down your fat and protein to generate glucose. For this you need normally functioning liver and kidney. So if these are functioning well, you won't go into low sugar. So if you take the correct medicines but you eat less, or suppose you take inadvertently a higher dose or a wrong dosage of a medicine, you may go into low sugar. How do I identify? These hormones which I just mentioned as a counter regulatory or a defense hormones, they all will go high in a diabetic, and that will cause palpitations, tremors, sweating, giddiness, etc., etc. So these may be the symptoms. So any diabetic patient should be aware of these symptoms of hypoglycemia or low sugars. In medical terms, we usually classify this as the initial warning symptoms. Tremors, palpitations, sweating, giddiness, hunger are early warning signs, and always they should have something to eat or drink immediately. Do not just pop in 2-3 spoons of sugar alone, because some of the diabetes medications you will not absorb sugar well. Ideally you should take glucose, or you should take something to drink like milk or some bread or idli or whatever you have at home. So eat something also, and you should contact your physician to adjust the medications if that was the cause of your low sugar.
Health tips for healthy life. For more such health tips from our senior doctors, subscribe to Health Basket YouTube channel and click the bell icon to get notified. Stay connected to us through our social platform. Protect yourself from the COVID-19 pandemic by building your immune system. Let us join hands to make the world healthy.